Imagine this scenario. You're simply walking, not running, perhaps heading to your car, strolling around the neighborhood, or navigating a grocery store. Now, consider an uncomfortable thought. If time were paused and someone could peer into your chest, would your heart appear calm or subtly strained? Many people assume walking is too gentle to have a significant impact, viewing it merely as movement rather than a form of preventative health. However, cardiologists perceive it differently. Surprisingly, your heart can respond to a simple walk as if it received a minor upgrade, sometimes within minutes. This is because walking does more than just burn calories. It alters blood vessel function, blood pressure regulation, and the effort your heart exerts daily. If you've been largely sedentary lately, these physiological changes are likely occurring within you right now. Please continue reading, as what follows is seldom discussed. Let's introduce the true protagonist of this narrative: your heart. Yet, even more critical than the heart itself is the intricate system it serves, your blood vessels. If your heart acts as the pump, your blood vessels are the highway network. Here's the crucial point. A pump can be in excellent condition, but if the highways become stiff, narrow, or dysfunctional, the pump must work harder. This subtle stress often goes unnoticed until it's too late. Your cardiovascular system operates quietly. It doesn't send warning emails or display pop-up notifications. It's more akin to a household water pump. You don't think about it until the pressure drops, pipes get clogged, or a leak appears. Now, here are some statistics that should grab your attention. Not to instill fear, but to foster awareness. High blood pressure affects over 1 in 4 adults globally, impacting approximately 1.39 billion people. Many are unaware they have it because it frequently presents without symptoms. A large meta-analysis involving over 111,000 individuals revealed measurable cardiovascular benefits for those walking around 2,700 steps daily compared to 2,000 steps. This isn't a demand for 10,000 steps or a marathon. It's the equivalent of a few errands and a short walk. The same analysis found the most significant cardiovascular benefit occurred around 7,100 steps per day, with additional gains diminishing thereafter. Thus, walking is far from insignificant. It's like putting your cardiovascular system on a gentle maintenance cycle, continuously flushing clean water through pipes to prevent sediment buildup. I want to be clear. Your body isn't fragile, and your heart isn't merely waiting to fail. Your body is intelligent and resilient. It adapts to what you consistently ask of it. If you consistently sit, it adapts to that. If you consistently walk, it adapts to that as well. Let's delve into the specific processes occurring within your heart and blood vessels. Not abstractly or motivationally, but chronologically. Early phase, 0 to 2 minutes. The ignition. As you stand up and begin to move, your muscles immediately require slightly more oxygen. Your nervous system promptly signals, "We're no longer at rest, we're in motion." Your heart responds by increasing its rate and force of contraction. This isn't a sign of distress, but rather your heart acting as a responsive engine. Consider it like turning a car's steering wheel. The power steering pump engages without panic, merely an adjustment. Simultaneously, blood flow through your arteries increases. This is vital because the endothelium, the inner lining of your blood vessels, is a sensitive, intelligent coating. It detects the flowing blood brushing against it. This flow acts like a gentle river current, prompting your vessel lining to release relaxing signals that help open up the vessels. Nitric oxide, essentially the body's internal traffic signal, is a key messenger in this process. You won't feel it, but your vessels become slightly more pliable. This mechanism partly explains why walking is linked to improvements in blood pressure and reduced cardiovascular risk over time. Middle phase, 3 to 10 minutes. The pressure shift. Many assume that an increased heart rate from walking is inherently stressful. The counterintuitive truth is that, in the long run, walking often reduces the pressure your heart must overcome. When your vessels dilate and become more flexible, it's like adding extra lanes to a highway. The same volume of blood can travel with less resistance. Research consistently shows that walking interventions lead to measurable reductions in blood pressure, typically a few points in systolic and diastolic pressure across various studies. This isn't magic, it's biomechanics. Increased movement leads to improved vessel signaling, which leads to less stiffness over time, making pumping easier. Your breathing also changes. You inhale more deeply and exhale more fully. This rhythmic breathing subtly influences your nervous system, guiding you towards a calmer, rest and digest state once you establish a steady pace. This is why walking is often described as clearing your head. Your body is quite literally altering its internal communication. Advanced phase, 10 to 30 minutes. Training the system. Here we reach the stage cardiologists truly value: repetition. While a single walk is beneficial, consistent walks are what fundamentally rewire the body. If your heart is the pump, walking is its daily practice session. Over weeks, your heart becomes more efficient. It can eject more blood with each beat, consequently needing to beat less frequently at rest. Studies show walking can reduce resting heart rate, a clear indicator of a more economical cardiovascular system. Furthermore, it's not just the quantity of steps, but also their quality. The 2023 meta-analysis found that a moderate to higher cadence, a brisker pace, was associated with additional mortality benefits beyond just step count. This isn't because you're pushing harder unnecessarily, but because you're training your system to manage slightly higher demands, much like upgrading a power grid to prevent strain during peak hours. Let's delve deeper, as there's a second, often overlooked layer to this story. Walking doesn't just train your heart like a muscle, it reshapes the environment in which your heart functions. Early to middle phase, what your arteries learn from walking. Picture your arteries as elastic garden hoses. When you're young and active, they're springy. When you're older or sedentary, they can become more rigid. Walking creates a repeated pattern of increased blood flow. This flow is like gently stretching the hose from the inside. Your vessel lining responds by becoming more adept at relaxing when it should and constricting when necessary, ensuring smooth blood circulation. Consequently, over time, the heart doesn't have to shout to be heard. It can speak softly and still efficiently move blood. This is why walking is consistently recommended for blood pressure management. It supports the very system that dictates how much effort your heart must expend. Middle phase, after meals. The underrated heart protection window. Here's a practical instance where walking becomes subtly powerful. Immediately after eating, your blood sugar rises, blood flow shifts towards digestion, and your body becomes metabolically busier. Studies indicate that post-meal movement helps mitigate these blood sugar spikes and supports better vascular function during this window. One study noted that both post-meal walking and carbohydrate restriction have been shown to reduce post-meal hyperglycemia and improve endothelial function in individuals with type 2 diabetes. Consider it like this. A meal is a delivery truck arriving at a warehouse. Walking is the warehouse staff showing up on time. Without the staff, boxes pile up at the loading dock. With the staff, the system runs smoothly. Even if you don't have diabetes, this concept is important because repeated sharp blood sugar spikes, day after day, can be a silent stressor on blood vessels over years. Walking doesn't eliminate life's demands, but it can soften their impact. Advanced phase, weeks to months. Measurable changes for cardiologists. With consistent walking, clinicians frequently observe improvements in blood pressure, and even modest reductions are significant over years. Resting heart rate, a key indicator of your heart's improved efficiency, also typically decreases. Population-level data links higher step counts to a reduced risk of cardiovascular events. However, the most profound change isn't merely a number on a chart. It's the fact that your cardiovascular system gains confidence. You can climb stairs without feeling breathless. Your pulse calms more quickly after stress. Your body no longer interprets minor exertion as an emergency. This isn't just motivation, it's demonstrable physiology. Now, let's briefly touch upon research findings without getting overwhelmed. What scientists used to believe. For a long time, the prevailing cultural belief was that if exercise wasn't intense, it wasn't valuable. Walking was thus often relegated to a lesser category, pleasant but not potent. However, the advent of wearable technology and the abundance of data it provides have fundamentally reshaped this perspective, allowing for precise measurements of activity. What we know now, and what surprised researchers. Surprise number 1. Benefits start surprisingly low. A significant 2023 meta-analysis published in the Journal of the American College of Cardiology, compiling data from 12 studies involving over 111,000 people, found substantial reductions in risk starting at approximately 2,517 steps per day for all-cause mortality, and about 2,735 steps per day for cardiovascular disease events, when compared to a baseline of 2,000 steps daily. This is the surprise. You don't need to go from 0 to perfect. You just need to progress from almost nothing to something. Furthermore, benefits accrue non-linearly, meaning initial small improvements can yield substantial gains for those starting from a low activity level. Surprise number 2. The optimal zone isn't 10,000 steps. The same analysis estimated an optimal daily dose of approximately 8,763 steps for mortality and about 7,126 steps per day for cardiovascular disease. This isn't because more steps are harmful, but because the most significant measurable reduction in risk occurs before reaching 10,000 steps. So, if you've been viewing 10,000 steps as a pass/fail test, you can now breathe a sigh of relief. Your heart doesn't judge you. It simply adapts. A surprising finding: even weekend walking can have a significant impact. A 2023 study published in JAMA Network Open examined adults who achieved 8,000 steps on only 1 to 2 days per week. This pattern alone was linked to a substantially lower risk of all-cause and cardiovascular mortality compared to individuals who hit 0 days. The protective effect reached a plateau around 3 days per week. This insight is crucial for real people, as not everyone can walk daily. Some are caregivers, some juggle 2 jobs, and others are simply exhausted. Regardless, your body still reaps benefits from whatever activity you can manage. Another surprising element? Pace adds an extra dimension. In that same 2023 meta-analysis from JC, step cadence, how brisk your steps are, was connected to additional health benefits, even after accounting for the total number of steps. Furthermore, an ES press release summarizing an analysis of individuals with high blood pressure highlighted that walking both farther and faster correlated with a lower risk of major cardiovascular events. Every additional 1,000 steps up to 10,000 was associated with meaningful risk reductions. Thus, intensity matters, but it doesn't necessitate discomfort. Often, moving just a bit faster than your comfortable pace is sufficient. Let's establish a clear safety context, without hype, just reliable information. Walking is among the safest forms of exercise. However, certain individuals should exercise caution and seek medical advice first, especially if they experience chest pain or pressure during activity, faint or feel on the verge of fainting during exertion, have known heart disease and are starting a new exercise program, have uncontrolled blood pressure, experience new or worsening severe shortness of breath, or are recovering from surgery, suffer from severe joint pain, or have a condition affecting their balance. In these cases, it's best to begin with supervision and a structured plan. The objective isn't heroic feats. It's about consistent activity that your body can comfortably tolerate. Let's bring this discussion to a close. At the beginning of this video, we posed a subtle question. If we could peer inside your chest, would your heart appear calm or quietly strained? Now you understand that the true answer isn't a dramatic yes or no. It represents a relationship, and walking profoundly alters that relationship. Consider the journey we've just explored. You started with a simple action, placing one foot in front of the other. Inside your body, your muscles demanded more oxygen. Your heart, like a finely tuned engine, adjusted its rhythm. Your blood vessels sensed the increase in blood flow and responded by sending signals to relax and open up. Your blood pressure regulation system got practice in maintaining flexibility. Your entire cardiovascular network began to function less like rigid plumbing and more like a vibrant, responsive highway system. And over time, the research straightforwardly and most reassuringly states, you don't need perfection to gain benefits. Benefits commence with just a few thousand steps per day. A realistic sweet spot for cardiovascular disease benefit hovers around approximately 7,000 steps daily. Even achieving a meaningful step target just 1 to 2 days per week may still be associated with lower risk compared to doing nothing. So, while walking isn't magic, it is a tool, a quiet, repeatable instrument that signals to your cardiovascular system, stay ready, stay flexible, stay capable. And that is arguably the most cardiologist-approved concept of all. It's not about intensity, punishment, or fear. It's about practice. Your body is not your adversary. Your heart isn't failing you. It's responding to the signals you send it every day through movement, rest, stress, sleep, food, and routine. Walking is one of the gentlest signals you can send that still generates genuine internal change. What surprised you the most? Was it the idea